You know that highly specific, slightly surreal feeling of standing in front of your bedroom mirror?
Oh, getting ready for a first date.
Exactly. Getting ready for a date, and it suddenly hits you that the last time you did this was, maybe a decade or two ago.
Right. It's a completely different lifetime.
It really is. You have the outfit picked out. You have somehow survived the modern gauntlet of dating apps, which is a whole other thing to get to this point. But there is this quiet realization creeping in.
That the body you're taking out tonight is simply not the same one you took to bars in your 20s or 30s.
Yeah, exactly. The landscape has completely changed.
The terrain is just different. I mean, you are likely navigating this re-entry after a major life shift. Maybe divorce, a profound loss, or, perhaps just coming up for air after 20 years of prioritizing your career and raising a family.
And layered on top of all that life experience, your biology is quietly, or well, sometimes very loudly, undergoing this massive architectural shift. So welcome to today's deep dive. Our mission today is laser focused. We are exploring how you navigate the modern midlife dating scene, start new relationships, and handle those really tricky conversations while you're actively going through perimenopause or menopause.
Which is such a vital topic.
Oh.
And we have gathered an incredible stack of sources for you today.
We really have. We are looking at psychological research, clinical guidelines from the Menopause Society, some behavioral analysis from Psychology Today, and some deeply revealing personal essays from platforms like This is Perimenopause and Kieran Singh's journals.
We're synthesizing all of this to give you a very real roadmap, because you need one for dating with confidence, disclosing your symptoms without, killing the mood, and completely redefining what physical intimacy looks like.
Right, but before you even consider downloading a dating app or meeting someone for coffee, the sources point to this mandatory first step.
Yeah, the very first relationship you have to renegotiate is the one with your own changing biology.
Let's get into the psychology of that, the sort of inner game. Because all the tactical dating advice in the world falls flat if you haven't addressed how you actually view your own menopausal transition.
It really does start from within.
I was struck by a piece in Kieran Singh's journal about a woman named Anna. She's 52. And following a pretty painful divorce, she remained single for over 10 years.
Wow. 10 years is a long time to build up defensive walls.
Exactly. And she had managed to convince herself that she was perfectly content, that she wasn't missing out on anything by avoiding romance altogether.
Right. She probably poured all her energy into her son and her work, which is a very common protective mechanism.
That's exactly what she did. But she eventually realized that her independence was actually just a mask for her fear of being disappointed again.
Which takes a lot of self-awareness to admit.
It does. So she decided to dip her toe back in, but she did it in a really fascinating way. She didn't just jump onto Bumble or Hinge.
What did she do?
She started taking herself on solo dates.
Oh, I love that.
Yeah, she would go to a nice restaurant alone or join a local meetup group just to practice being in a social setting again. Her biggest victory wasn't locking down a partner.
It was proving to herself that she could do it.
Right. Showing herself she was still a woman capable of giving love, open to receiving it, and fundamentally worthy of it.
The psychology underpinning Anna's approach is crucial for midlife daters. Re-entering the dating pool in your 40s or 50s often triggers this profound, almost primal fear of being seen.
Because you are asking someone to look at a very real, unfiltered, and physically changing version of yourself.
Exactly. The instinct is to wonder if anyone will actually want this new version. And the sources emphasize that you have to date from a place of abundance and self-love, not a place of lack.
Right. If you are dating just to fill an empty space in your life, you project insecurity.
You do. But if you view dating as opening a door to share an already complete life, the energy you radiate completely shifts.
Which is, it's incredibly hard to do when your body feels like it's actively betraying you.
Oh, absolutely. It's a huge hurdle.
There is a story from This is Perimenopause about a woman named Jen that perfectly captures this struggle. Jen was dealing with the full brunt of perimenopause. She was exhausted, her moods were all over the place, and her body was redistributing weight.
Right. Those new curves in places you've never had them before.
Exactly. She suddenly had this totally different shape, and she felt like a stranger in her own skin.
That's such a common feeling.
So she went on a blind date feeling that way, and it was catastrophic. She felt so uncomfortable and out of place that she went home and wanted to permanently cancel her romantic life.
Just hide forever.
Literally. But she didn't stop there. She took that awful experience straight into therapy.
Good for her. That's a brave step.
It was, and they worked through this profound aha moment where Jen realized she was punishing her current body for not being her past body.
Wow. Punishing her current body for not being her past body. That is powerful.
Right. She decided to radically accept the new curves. She threw out all the baggy clothes she was using to hide herself, and she bought clothes that actually fit the shape she had right now.
Confidence is truly the sexiest outfit you can wear.
It is, and she stepped back out there. The shift in how the dating world responded to her was instantaneous. People were literally telling her she was glowing.
What Jen experienced is a textbook example of how we internalize biological shifts. Society heavily conditions women to view aging and menopause specifically as this steep decline.
Like your best days are behind you.
Exactly. And when you absorb that narrative, every hot flash or physical change feels like a personal failure. Jen's therapy helped her reframe this biological transition as an evolution rather than a loss.
Yeah.
That psychological pivot is the absolute baseline required for healthy midlife dating. Acknowledging that you still have desire doesn't make you needy. It confirms that you are vibrant and human.
It makes me think about upgrading your phone's operating system.
Oh, that's an interesting way to look at it.
Yeah, like when you first install the new OS, you might really miss the old interface at first, right?
Yeah.
It takes a minute to figure out where the buttons are, and it feels a little clunky.
You're just swiping around trying to find your apps.
Exactly. But once you actually embrace the new features, you realize it runs way deeper and more efficiently than the old version ever did. It's an upgrade.
I love that analogy. You are bringing decades of resilience, clarity, and emotional intelligence to the table now. You are not the person you were at 25, and that is your greatest asset, not a liability.
But the reality is, once you do that inner work, once you build that internal confidence, and you finally sit across a candlelit table from a real live human being.
You eventually had to talk about the physical realities.
Right. How do you actually bring up the M word? How do you tell a brand new partner that you are going through menopause?
Moving from internal acceptance to external disclosures, where a lot of people just freeze. But Psychology Today offers a really compelling guideline for midlife dating. They say, slow on intensity, early on honesty.
Slow on intensity, early on honesty. Let's look at how that actually works in practice, because one of the sources highlighted a woman named Trish who takes that advice to the absolute extreme.
Oh, Trisha's story is fascinating.
It really is. She treats menopause as her ultimate dating litmus test. See, Trish uses an estrogen patch to manage her symptoms, and it leaves a visible adhesive mark on her skin.
Right, so there's no way to hide it if a date progresses to the bedroom.
Exactly. So rather than waiting for an awkward discovery, she proactively brings it up. She drops it into conversation early on purpose.
Which is such a power move.
She figures that if a man reacts with curiosity and compassion, well, he has the emotional maturity to be a real partner.
And if he recoils or gets visibly uncomfortable or makes a weird joke,
Then she immediately knows he lacks empathy.
yeah.
As she puts it, she lets the trash take itself out.
I mean, she refuses to allow this unspoken tension to exist in the room when it's time to get naked and be vulnerable.
She really does. We see a variation of this in Lisa's story, too. Lisa was terrified to date because her hot flashes were sudden, severe, and just entirely unpredictable.
They can really catch you off guard.
Yeah. So, a few dates into a promising new relationship with a guy named Tom, she suffered a massive hot flash in the middle of a high-end restaurant. She described it as practically melting into a puddle right there at a table.
Oh no, that is literally everyone's worst nightmare.
Okay, but I have to pause and play devil's advocate for a second. Everything we are taught about the early stages of dating revolves around keeping things light, breezy, and effortlessly charming.
Right, the typical dating rules.
Yeah, you don't typically drop your hormonal transition into the chat or start aggressively sweating over the appetizers. Isn't bringing up estrogen patches and hot flashes on date 2 a massive romance killer?
I totally understand that fear, but you have to consider the context of midlife. In your 20s, breezy works, because neither of you has much baggage.
Right, there's no history.
Exactly. It's easy to be light when there's very little history to carry. But in midlife, vulnerability is the actual currency of romance. Normalizing these biological realities early on prevents massive misunderstandings down the line.
It completely shifts the power dynamic, doesn't it?
It does. Instead of hiding a shameful secret and constantly worrying you'll be found out, you are extending an invitation to your partner to live in your reality.
And when Lisa had that hot flash, Tom didn't flinch. He didn't look away in disgust.
What did he do?
He leaned in, he listened, and he asked her what she needed in that moment.
See? That single reaction communicated more about his character and his capacity for partnership than 100 breezy superficial dates ever could.
He passed the litmus test because he demonstrated that he could handle the reality of her life.
Precisely. Establishing that emotional safety early is the non-negotiable prerequisite for the next phase of the relationship.
Which brings us to a major pivot point. If your new partner passes that test and things are going well, the relationship is naturally going to progress toward physical intimacy.
And our sources dedicate a massive amount of ink to one unavoidable truth. Midlife biology demands that you throw out your old playbook for the bedroom and write a completely new one.
The very first thing the clinical sources tackle is a highly pervasive myth that really needs to be dismantled. The assumption that menopause inherently kills your sex drive.
Yes, while desire certainly fluctuates for many women due to hormonal changes and fatigue, a significant portion of women actually report an increase in their sex drive post-menopause.
Wait, really? An increase?
Yes, because the fear of pregnancy is completely gone.
Oh, that makes so much sense. For decades, sex for women is inextricably linked to the mental load of preventing an unwanted pregnancy. Once menopause is complete, that deep-seated background anxiety just vanishes.
Psychological brakes are totally taken off.
But, and this is a big but, while the mind might be eager, the biology requires some serious adaptation.
That's the catch. As estrogen levels drop, the body stops sending robust blood flow to the pelvic region. This leads to a loss of collagen and elastin in the vaginal tissues.
The tissues literally become thinner and less resilient.
Exactly. And the natural lubrication mechanism significantly decreases. Clinically, this is known as genitourinary syndrome of menopause, or GSM.
And the direct result of GSM is pain. But every single clinical source we reviewed practically screams this from the page. Pain is not the price of sex.
It absolutely is not.
You are not supposed to just grit your teeth, stare at the ceiling, and push through the discomfort to please a new partner.
Pushing through the pain is incredibly damaging. When you endure painful intimacy, you create a negative feedback loop in your central nervous system.
Your brain starts associating physical closeness with pain and anxiety.
Right, which kills desire faster than any hormone drop ever could. The intervention here is very straightforward and practical. High-quality, paraben-free lubricants. The sources highlight a simply timeless collection, specifically formulated for menopausal tissue, are essential.
And the sources also mention localized vaginal estrogen, right?
Yes, localized estrogen can actually restore the thickness and elasticity of the tissue without affecting your systemic hormone levels.
Okay, so the logistics of that make perfect sense. But the actual execution is where it gets sticky.
How do you mean?
Well, imagine you are in the heat of the moment with someone brand new. Things are getting heavy, and you realize you need to hit the brakes. You need to grab the lubrication, or you need to ask for more time because your body isn't responding the way your brain wants it to.
Right, they can feel incredibly awkward.
Exactly. How do you communicate that without deeply bruising this new partner's ego?
The experts provide very specific communication scripts for this exact scenario. The key is to heavily utilize I statements that firmly place the focus on your biology rather than their performance.
Give us an example of that.
You might say, I'm really enjoying this and I want us to keep feeling close, but I've noticed my body needs a little more time to warm up these days.
Oh, that's good.
Or let's grab some lubrication so this feels amazing for both of us. It has nothing to do with you. It's just my hormones.
You are simultaneously reaffirming your attraction to them while maintaining a firm boundary around your physical comfort.
Exactly. That dual approach is vital, especially when we factor the male perspective into this equation.
Yes, we looked at some fascinating data on men's midlife changes. Over 50% of men over the age of 40 experience some degree of erectile dysfunction.
It's extremely common.
So, picture this highly likely scenario. She is experiencing the tissue thinning and dryness of GSM, and he is experiencing the early stages of ED. If neither of them has the courage to talk about it, the silence is just deafening.
It creates a tragic mutual spiral of shame.
How so?
Well, without the context of biology, humans default to insecurity. A man will likely interpret his partner's physical dryness as a clear sign that she is no longer attracted to him.
And meanwhile, the woman might interpret his ED as proof that her changing body is no longer desirable to him.
Both partners are lying in the dark, suffering in silence, feeling utterly rejected, when in reality there is no lack of love or attraction. They are simply two people colliding with normal midlife biology.
Speaking the truth out loud instantly shatters that shame spiral.
It really does. It totally changes the expectation of how intimacy is supposed to start. The sources talk a lot about the shift from spontaneous desire to responsive desire.
Which reminds me of driving a classic car.
Oh, I like where this is going.
Yeah, you can't just turn the key and floor it like a rental car. You have to let the engine warm up, check the oil, and really appreciate the ride. The car isn't broken. It just requires a different kind of attention to perform beautifully.
That is a perfect analogy. In your 20s, your hormones act like lighter fluid. You can just strike a match out of nowhere.
Yeah.
The whole thing goes up in flames instantly. That is spontaneous desire.
But in midlife, you have to actually build the fire.
Exactly. You need the kindling of emotional connection, you need the sustained friction of non-sexual touch, and you need extended foreplay. It's about shifting the focus from mere performance to comfort, safety, and collaboration.
Speaking of safety, the biology of GSM actually connects to a massive blind spot that midlife daters have regarding physical risk.
This is such an important point.
Because of that thinning vaginal tissue we talked about, friction doesn't just cause pain, it creates microscopic tears in the tissue. And those microtears make a postmenopausal body significantly more susceptible to contracting sexually transmitted infections.
And midlife daters are notoriously bad at practicing safe sex. It is a profound cognitive disconnect.
Because pregnancy isn't a risk anymore.
Right. If you have been monogamously married for 25 years and you know pregnancy is biologically impossible, condoms haven't crossed your mind in decades. But STIs do not care about your age.
There is a highly sobering cautionary tale in the medical literature we reviewed. A doctor detailed treating a 45-year-old patient who had recently divorced.
What happened?
She traveled to New York City, had this thrilling, liberating, hot affair with a younger man, and realized weeks later, with a sense of utter dread, that she hadn't even thought to ask about STIs or use a barrier method.
Her brain was entirely focused on the lack of pregnancy risk. The medical community sees this constantly.
So what's the protocol?
The CDC's recommendation for this age demographic is the talk, test, and treat method. When you are anticipating a sexual encounter with a new partner, you must have the uncomfortable conversation beforehand.
You have to exchange STI testing histories.
Yes, and you must always use barrier methods with new partners until both of you are tested and exclusive.
And as a crucial public service announcement for the listeners who are in perimenopause rather than full menopause, your fertility is a sneaky bugger.
It really is.
Your periods might be wildly unpredictable, vanishing for months at a time, but you can still ovulate and conceive. The clinical guidance is absolute on this. You must continue using pregnancy protection until you've gone 12 consecutive months without a single period.
Do not gamble with your reproductive system just because your cycle is sputtering out. The stakes are simply too high to rely on assumptions.
So synthesizing everything we've uncovered today, stepping back into the dating pool requires rebuilding your self-worth internally, ensuring you date from a place of self-love.
It means utilizing your menopause transition as a boundary-setting litmus test.
Right, to weed out emotionally stunted partners. It demands that you communicate openly about your body's changing needs, like requiring lubrication and a slower pace.
And it absolutely requires you to never skip the lube or the STI talk.
Never. So as we wrap up, I want to toss it over to you for final thought.
Yeah, I want to leave you with something to really ponder as you navigate this terrain.
Yeah.
What if we completely flipped the cultural script? What if we stopped viewing menopause as an embarrassing hurdle that you have to somehow overcome to date successfully?
I love this framing.
Think about what the biological realities of midlife actually force you to do. They force you to be radically honest about your needs. They force you to prioritize your physical comfort over someone else's ego.
Right.
And they demand deep emotional maturity, empathy, and communication from a partner right from the very first date. If menopause organically filters out the people who are incapable of genuine adult intimacy, isn't this transition actually the greatest dating advantage you have ever had?
The greatest dating advantage you have ever had. That reframes everything. You aren't operating at a deficit. You are operating with a built-in truth serum.
Exactly.
Well, thank you for joining us on this deep dive. Take that truth serum, step into this next chapter of your life, and navigate your love life completely unapologetically. We'll catch you next time.